Good morning, everyone. I'm Dr. Michael Richmond, a double board certified cardiothoracic surgeon. Before we start, I've been asked, what does that exactly mean? Well, it means that I completed a 5-year general surgery residency at the Los Angeles County University of Southern California Medical Center. And then after doing the prerequisite number of cases, I completed an oral and written exam by the American Board of Surgery. After that, I completed a 2-year cardiothoracic surgery residency at the University of Miami Jackson Memorial Hospital, and also completed and passed an oral and written exam to become board certified by the American Board of Thoracic Surgery. So now let's move on to today's topic, which are the warning signs of colorectal cancer that should not be ignored. I have previously done videos on colorectal cancer screening, including Cologuard and colonoscopy, and a podcast about preventative cancer screening in general, and I encourage you to watch those. So first, a little bit about the epidemiology of colorectal cancer. So an estimated 154,270 new cases of colorectal cancer will be diagnosed in the United States in 2025, with 52,900 deaths expected. So these projections include approximately 107,000 new colon cancer cases and 47,000 new rectal cancer cases. Now, what are the early signs of colorectal cancer that cannot and should not be ignored, especially in younger individuals? Because we are seeing cases in younger and younger patients, even in people in their early 20s. So the signs and symptoms that need to warrant further investigation, regardless of what your doctor tells you, include, first, rectal bleeding is the most significant warning sign, particularly when blood appears mixed in your poop rather than just on the toilet paper. This symptom shows the strongest association with early onset colorectal cancer risk. Second, iron deficiency anemia, which is called the microcytic anemia for you geeks who love medicine, and this represents another critical red flag, especially when it's unexplained. This may occur even before other symptoms become apparent. Next, there's abdominal pain and altered bowel habits like new onset diarrhea or constipation, and they're common presenting symptoms occurring in approximately 40 and 27% of early onset cases, respectively. So these symptoms are particularly concerning when persistent and unexplained. Also, unintentional weight loss should prompt immediate evaluation. The National Comprehensive Cancer Network emphasizes that all patients, regardless of age, presenting with these symptoms should undergo prompt evaluation. The presence of one red flag symptom is associated with a 1.9-fold increased risk of early onset colorectal cancer. Remember, that's when we want to catch it. 2 symptoms with a 3.5-fold increased risk, and those with 3 or more symptoms, a 6.5-fold increased risk. In most unexplained cases, an anal rectal exam, which is actually looking at your anus and looking in your rectum, and a colonoscopy must be considered. Basically, it should be done. This heightened vigilance is particularly important because approximately 1 in 10 new colorectal cancer diagnoses now occur in individuals less than 50 years of age, as I said. And 3/4 of early onset patients have no family history of the disease because there are familial syndromes and diseases which make you high susceptible. And it also should be considered in people with documented hemorrhoids who are treated and those don't resolve. They should undergo a colonoscopy. And remember, just because your doctor says it's nothing, I always tell people, they're not coming to your funeral. So if it seems strange or if somebody's being dismissive of you, you find a new doctor, and a doctor acceptable to see would be a gastroenterologist or a colorectal surgeon. So with that, if you have any further questions, you want a consultation, you need guidance or advocacy, you can go to my website at www.paladinmds.com. And thank you for listening, and have a great day.